Dementia. It's a word that carries fear, uncertainty, and a profound sense of loss. But what if we told you that early diagnosis could change everything? What if detecting it earlier could slow the progression and improve the quality of life for those affected? The truth is, early diagnosis of dementia is essential, and it could make all the difference. Dementia is a general term used to describe a range of cognitive impairments that interfere with daily life. Alzheimer's disease, the most common form of dementia, accounts for 60 to 80% of all cases. But the causes go far beyond just aging. Genetic factors, environmental influences, lifestyle choices, and even brain injuries can all play a role in the onset of dementia. The earlier we catch it, the better the chances we have to slow it down. One of the biggest misconceptions about dementia is that it's just a normal part of aging. While it's true that our cognitive functions naturally decline as we age, dementia is not a normal part of the aging process. It's a disease, and like any disease, early intervention can make a world of difference. So, how is dementia diagnosed? It all starts with recognizing the signs. Early indicators can be subtle, but they're there. Memory loss, especially forgetting recent conversations or appointments, is often the first clue. But it's not just about forgetfulness, it's difficulty planning or solving problems, confusion with time or place, and trouble with spatial relationships. Have you ever misplaced your keys and forgotten where you put them? We all have. But in dementia, these symptoms can escalate to a point where the person can no longer find familiar places, or even fail to recognize loved ones. What else should you look for? Changes in mood or personality are also significant. People with dementia may experience extreme mood swings, depression, or anxiety. They may act out of character or become more suspicious or paranoid. Disorientation and poor judgment can also be red flags. When should you start looking out for these signs? Typically, dementia affects people over the age of 65, though early onset dementia can appear as early as the 40s or 50s in rarer cases. The risk increases with age, so if you're approaching 65, it's important to start paying closer attention to memory and cognitive changes. But even younger people should be aware, especially if there is a family history of dementia or Alzheimer's disease. The rate of onset varies, but once symptoms begin to show, they often progress at different speeds. Early stages of dementia may only involve mild cognitive decline, but in the later stages, individuals may struggle with basic daily activities and lose the ability to communicate. Now, here's where things get truly important: the tests that can diagnose dementia. It's not just about observing symptoms. Medical professionals conduct a series of assessments to confirm a diagnosis. Cognitive tests like the Mini Mental State Examination, MMSE, and the Montreal Cognitive Assessment, MOCA, can identify cognitive impairment. Brain imaging, such as MRI or CT scans, is used to look for brain changes that indicate damage or shrinkage, often seen in Alzheimer's and other dementias. But there's more. Blood tests can rule out other possible causes of cognitive decline, such as vitamin deficiencies or thyroid issues. And, in some cases, genetic testing can provide clues about inherited forms of dementia. Why is early diagnosis so critical? Because it opens the door to treatments and lifestyle changes that can slow the disease. While there is no cure for dementia, medications can help manage symptoms and, in some cases, slow progression. More importantly, a proactive approach with healthy habits, like maintaining a balanced diet, staying physically and mentally active, and managing chronic health conditions, can significantly reduce the risk or delay the onset of dementia. It's easy to feel helpless when faced with the word dementia, but the truth is, early diagnosis gives you control. It gives you time to plan, to manage, and to make changes that can have a lasting impact on quality of life. If you or a loved one are experiencing any of these symptoms, don't wait. Speak to a healthcare professional. Get tested. Get informed. And remember, the earlier you catch it, the better the possibilities. We can't always prevent dementia, but we can certainly give ourselves the best chance at managing it. Early diagnosis could change everything. It could change your life or the life of someone you love. So, take action. Don't wait.